Hello and welcome to my video on sulfonylureas. I hope to provide an overview of this medication class for anyone interested in learning more about them. They're an interesting class of medications which have been around for quite some time, and this overview should provide good information to the medical community or to anyone on or about to be on them. So sulfonylureas are actually part of a larger class of medications called insulin secretagogues, which both names are super fun to say, so I'll keep their use to a minimum. For the most part, there are just three main ones in use today: glipizide, glimepiride, and glyburide. There are older ones as well, but those are not used anymore because there is really no point to do so from a practical point of view. Now these medications are used to treat diabetes, and that is it. Specifically type 2 diabetes and not type 1. This will become clear later, but it is because they lower blood glucose or sugar levels by increasing insulin from the body. This would just not work in a type 1 diabetic. Now, even though these are the oldest class of oral diabetic medication, they are still used pretty commonly today. This is certainly not because they are wonder drugs or even medications without side effects. In fact, most doctors would much rather prefer other medications over these. So, why are they common then? Because these are cheap. Most of the better medications cost so much more, so that is why these stay in use until today. That is not to say these are bad medications. They still lower the A1C, or the way we measure long-term sugar control, by about 1%, which is still good if you consider that the best ones do not get much higher than 2%. But let us stay focused and see how these drugs do what they do. So the sulfonylureas work by stimulating the pancreas to push out more insulin than it normally would. I like to think of this as these meds just squeezing the pancreas like a wet sponge till they can wring out every last drop of insulin. A metaphor, of course. They also work less significantly in the liver and some random parts around the body, but that is certainly not the main effect and contributes very little to its overall effectiveness. Now this squeezing, if you will, happens whenever the medication is in your system, which means it will lower the sugar levels regardless if they are high or not. For most diabetics it is not really a problem, but this does lead us to the main side effect of this medication, hypoglycemia. I think it would benefit us to talk a smidge in depth on what hypoglycemia or too low of blood sugar really entails. This happens when anyone's sugar levels drop too low. Now there are numbers attached with this, but I think the interesting part is that if someone normally has a glucose or sugar level that is high, they can experience hypoglycemia at levels that non-diabetic people would be having a sugar rush. So do not equate this to numbers only, but what is normal for the person on the medication. These low sugar levels are typically associated with sweating, being irritable, or feeling hungry, what a lot of people describe as hangry. A fast heart rate, being confused or unstable can also commonly happen. This can get severe enough where someone passes out, has a seizure, or even passes away in severe cases. If anyone notices any of these effects, there is a simple way to prevent it from getting serious. Typically, some simple sugar will shoot the levels right back up, so a hard candy or some soda will fix it. Just make sure that this is not used as an excuse to have the whole container. The best bet is to also follow this with a higher protein meal so the sugar levels do not plummet again afterwards. I do want to point out that people get different symptoms of hypoglycemia. They could get one of these or all of them, could even in some cases get some other random effect. However, the same symptoms typically appear repeatedly for the same person, so after one episode they should know what to look for. Okay, now back to the actual medications we were talking about. So, side effects. We just said hypoglycemia. There is also weight gain, pretty common with these drugs. This should be expected to at least some degree for most people. Nausea can also be fairly common towards the beginning of treatment as well. This is relevant because if someone is not eating due to the nausea or another reason such as a fast or just being sick, it is not the best idea to take these medications because, as I said earlier, they will still lower sugar levels even if you are not putting any into the system. Another thing to keep in mind that is not really a side effect but more of a precaution is sulfa allergy. Now if you look into this, it is most likely not something to actually be concerned about, because while these have sulfur in them, it is not the type of sulfur that people are allergic to when they say they have a sulfa allergy. Nonetheless, the monograph or the official information from the manufacturer says to not use these with a sulfa allergy. Take that as you will. Also, as an aside, do not use glyburide if there are any kidney issues. Use one of the other two. To further specify, with each of the meds in this class, they should all be taken with the first meal of the day, except the immediate release glipizide, which should be taken 30 minutes before the first meal, which this glipizide is also the only one that should be taken twice a day at higher doses, while the others are just once a day. Now before I wrap this discussion up, I do want to mention what I think is the most interesting aspect of this class of medication, and that is the duration of use. So these work pretty decently when you first start taking them, but as the years go by, the effect quickly diminishes and the drug basically becomes useless. Obviously the timing is different for everybody, but it seems to be about 2 to 5 years max that you can get out of these medications. And 5 years is pushing it. This relates back to how these drugs just use the pancreas as a wet rag, and it can only take so much before throwing in the towel. However, you can actually stop these and restart them much later, and the good effects resume. There has been some thoughts that the longer these are used, the worse people respond to insulin treatment later on, so restarting them might not be the best idea in that case though. Sulfonylureas are still commonly used today, as most everyone can afford them and they lower the sugar levels decently. They are a reasonable choice for someone to start on, but long-term use needs to be monitored. I hope this overview of the sulfonylureas has benefited you in some way or another. I do release videos fairly regularly on medications and pharmaceuticals, so if you like quick, concise overviews, I hope you subscribe so you can keep benefiting from my videos. Have a good day.